Healthcare workers are at the core of health systems everywhere. But since HIV and AIDS have reached pandemic proportions, many health systems are at breaking point. Sub-Saharan Africa faces the greatest challenges. It carries 25% of the global disease burden, yet the region only has 3% of the global health workforce.
The environment that health workers work in is dangerous and in many respects unsatisfactory, and therefore it should not be surprising that there's what they call the brain drain from sub-Saharan Africa, that health workers here will go to work elsewhere. Most people think it's to make more money, and perhaps that's the situation. But the lack of support for health workers, the lack of help for them themselves, is also a primary reason. So they're not just being pulled out, they're being pushed out.
Here in Swaziland, healthcare workers have been hit hard by the HIV/AIDS pandemic. The country has the world's highest HIV prevalence at 26%, which has had a significant impact on healthcare workers who are overstressed and undervalued.
Most people in the country are so sick, so they flood these hospitals where the health workers are working, and some of them you find that even the wards are so full that other patients are on the floor because the beds are full of sick people which you cannot send home. So that themselves is so much traumatizing to the healthcare worker.
It affects you both physically, you become very tired, psychologically and spiritually you are affected. Seeing people complaining when you are trying to give out the best to them and you cannot match their expectations because of the number that you are on the ground, your morale becomes low.
To address this situation, the International Council of Nurses, the Swaziland Nurses Association and the Danish Nurses Organisation in partnership with BD have initiated the Swaziland Wellness Centre for healthcare workers and their immediate families. It aims to address the severe healthcare worker crisis in Swaziland through attention to the health, well-being and capacity of the whole health workforce. It also includes a crucial HIV testing programme.
If I want to go for voluntary testing, I want to know my status, which is the thing now that every person must be aware of his or her own status. It means I will have to join the queue of the people that I service as a nurse. So it becomes so frightful and you feel like, no, I should not do this. I would rather stay without knowing my status either than going and joining the same queue of the people that I serve every day. But now here comes Wellness Centre.
The Wellness Centre also provides stress management, professional development and counselling services. Julia is an assistant nurse and is HIV positive. She uses the Wellness Centre to help her cope with the burden of being one of many caregivers living with HIV.
At times I feel quiet and I weep because you know, when you are an HIV woman or a HIV positive person, you go up and down the ladder. The Wellness Centre now is benefiting me because since I've been on medication for some time, but I still have the psychological problems. But with the Wellness Centre, I just go there, they give me continuity of care, which is counselling, and I come back at work. I don't feel down like I used to be. We are being treated in a way that we are professionals.
I think the success of the Wellness Centre is demonstrated in part by the interest there is shown from partners. And there are very few innovations right now that look at providing services to healthcare workers, caring for the carers. And so as a concept, it's highly successful. When you talk with nurses about what they need, this is part of the answer.
The Wellness Centre's impact is such that the World Health Organization, Physicians for Human Rights and others have cited it as an innovative and effective response to the healthcare worker crisis in sub-Saharan Africa.
It's the first time that there has been an intervention to address specifically the well-being and needs of health workers. A reasonable investment in a facility like this ultimately will reach all health workers in Swaziland. Every one health worker who's off the job because of illness or disease is a major loss to society. So this is an extremely important concept.
The Awareness Center is the best thing that can ever happen to us here. I think everybody is happy with it.
You get a good care, you get confidentiality, you get the courage to live, you get the hope that there is life above HIV.